Welcome back to Gentle Dental. I am Dr. Sarah Chinnery, and we are going to be getting to the root of something that most people don't realize affects their teeth, their diet, and gut health. It's a topic that does not get taught in dental school typically, so I'm thrilled to be joined by Jacey Fitzpatrick, a registered dietitian who focuses on the oral microbiome, gut health, and how nutrition can shape the health of your entire smile. Jacey earned her bachelor's degree in dietetics from Nichols State University in 2017, then went on to complete her dietetic internship at North Oaks Medical Center in Hammond, Louisiana, where she gained over 1,200 hours of hands-on practice to earn her credentials. Now she balances her expertise in nutrition with her roles as a stay-at-home mom, group fitness instructor at a local gym, and an evening dietitian for the company Nourish. Jacey brings a unique perspective of both professional training and real-life application, and I know you're going to love learning from her today. Can you tell us a little bit about yourself and what exactly is a dietitian?
I actually was born and raised in South Louisiana, so alligators in the backyard. My parents had a house on a canal. We fished in the backyard. So that's kind of like the typical Louisiana lifestyle that I lived. And then I attended my undergrad at Nichols State University in Thibodaux, which is pretty much down the bayou from where I grew up. In order to be a registered dietitian, you have to complete a bachelor's in dietetics from an accredited university. A lot of universities will have a nutrition program without verbalizing, hey, you need to go to an accredited university to complete an internship. That's what I did. Luckily, I picked a university that had an accredited program because I didn't know anything about being a dietitian or the pathway to become a dietitian till about my junior year of college. And I think everyone in my class was surprised that we had to do an internship. So hopefully they're verbalizing that a little bit better as all of the other students come in, but applied to an internship, and it was the match process that happens in medical school. So we picked our top four, and then our school picked us and we had to match, which is kind of insane that we did that to be a registered dietitian. But I guess they were trying to get fancy and matched with a place in Hammond, Louisiana. So I didn't move too far from home. Started working at a long-term acute care facility. I've managed a hospital kitchen in a small rural hospital. So I've done food service management, branched off to a little environmental service management during COVID. Everything during COVID was kind of crazy, and worked in the school system with kids with food allergies and menu alterations, then had a baby and was like, well, I think I can take a step back because the field is so flexible. I now can see patients at 7 o'clock, 8 o'clock at night in my office, in their home. So that's a little bit about my career path. I've been married for 2 years and I have a 15-month-old who has completely changed my career, but for the better.
What's the difference between a dietitian and a nutritionist?
That is a wonderful question. So this really adds value to our profession. A registered dietitian has to complete a bachelor's degree plus a 1,200 practice hours in an internship. At the time I became a dietitian, I think in 2021, 2022, they added the master's program to it. So I do not have a master's degree. It's not something that I think I need to increase my pay, but it is something that if you want to be a registered dietitian now, you have to do the master's degree, but that's usually lumped into the internship. So you have the 1,200 practice hours. You have to sit for a national board exam, pass that, earn your credentials, get licensed to the states that you want to practice in. And a nutritionist is someone who might get a certification online. They're really there to help healthy people stay healthy. Dietitians is the management of chronic diseases through nutrition. So it's called MNT, medical nutrition therapy. We took nursing prerequisites, chemistry, biochemistry, all of that background. And then like a nutritionist might not have to have a degree. They just have like an online credential that they can just promote healthy habits. Both are really good and both help people. I really don't down on nutritionists because I think it takes everyone to help people get to their healthier, best self.
I had no idea how grueling it was to become a dietitian.
It is. So it's like I feel like we're always fighting to get value. It's like we put up with a lot of stuff to get where we are. We volunteered lots of hours, as every profession does. But I remember walking into a rotation, and I mean, it's humbling. Our food service rotation, you're washing dishes all day, you're washing patient trays all day, and you're running the dishwasher and you're serving food. You're doing that and not getting paid. So it is humbling, and I think it's a great experience. You really have to see all aspects of nutrition because it is just so vast. But yeah, we need more value. So I love the question when people ask that because there is a significant difference.
Let's start with the big picture. How does what we eat actually impact our mouth and our teeth?
Yes. So our mouth greatly affects our nutrition. And on the reverse side, our nutrition affects our mouth. So they definitely coincide, they intertwine. I'll kind of start with the oral cavity. So as far as like the microbiome goes, it's full of good and bad bacteria. It's actually the second largest microbiome besides the gut. So from a nutrition standpoint, digestion starts in the mouth. So the second food hits your mouth, honestly, when you're salivating, that's when digestion starts because those enzymes start working. They're getting ready to chemically break down the food. But okay, we take our first bite of food and the mastication mechanical process is breaking down the food. That's the first step of digestion, along with our saliva with the enzymes breaking down the food at a chemical reaction. A lot can depend on digestion. So if you have poor oral health or great oral health, it's going to really affect your digestion. So say we have a couple missing teeth, maybe we have some tooth decay, it hurts to chew. Well, maybe we're not going to choose the right food that we need to eat, or we're not going to be able to break them down as well as we should. And I guess to the microbiome in the oral cavity, it's almost like a neighborhood. So I like to use this example when we're talking about gut health because using all kinds of crazy bacterial names can get confusing. In the oral cavity microbiome and in the gut, it's like a neighborhood. So if you live in a subdivision, a neighborhood, you have a variety of people. You have babies, you have elderly people, you have different occupations. So there is a variety of people, and that's like the bacteria in our microbiome. We want a good variety. Now, there are some outside factors that can negatively affect our neighborhood: a tornado, hurricane, fire, criminals. They can affect our neighborhood, and that would be like pathogenic microbiomes. That could be trauma, it could be loss of teeth. So, all of those things can negatively affect our microbiome from the oral cavity standpoint.
Is there really a link between our gut and oral health? Or is that just kind of like a buzzword combo?
There is absolutely a link. There's a huge link. So everything is connected. Like I said, your oral cavity is that first point of digestion and it hits the GI tract. It is part of the gastrointestinal tract. Whatever enters in our mouth is coming into our body, which can be digested in the bloodstream. Having a good, healthy oral hygiene, good, healthy oral microbiome, good variety in bacteria is going to positively affect your GI tract and your gut health. So all body systems are connected all through the GI tract there.
What are some signs in the mouth that might suggest a deeper digestive or gut issue could be going on?
There are lots of things that your mouth can tell you nutritionally. So it could tell you about some deficiencies, vitamin B deficiencies. And from a nutrition standpoint, dietitians can do a nutrition focused physical exam. So we go from head to toe in a patient. But part of that is making the patient open their mouth, looking at the tongue. So if their tongue is red, like beefy red, it can indicate an iron deficiency. As far as the bacteria in the mouth, if there's a lot of inflammation, the patient could have diabetes. Diabetes can definitely affect inflammation in the gums. And then obesity is a chronic state of low grade inflammation. So a patient who might be higher on the BMI that classifies them as in the obesity range, their body is chronically inflamed. That could definitely affect the mouth, the gums, and depending on food choices and oral hygiene, that can definitely be some telltale signs of some nutrition related problems. Same thing with tooth decay. If there's some tooth decay, not saying it's directly related to eating, having poor hygiene, because some things happen like genetics and things like that. But say we have diabetes or we have heart disease really affects the circulatory system. So you have blood vessels in your gums. So it's definitely going to all connect. And like I said, all body systems are intertwined.
Let's talk about food. What are your top nutrient rich foods that support strong teeth healthy gums, and a resilient gut.
Some great foods. It depends on the quality of our dentition, right? We want to make sure we have some strong teeth. Nuts and seeds are wonderful. They're very nutrient dense, packed with antioxidants, protein, fat, fiber. Yogurt is definitely a power food. Fruits, vegetables of any kind. I do not discriminate against frozen vegetables. Canned vegetables are better than no vegetables at all. Legumes, beans, those are high in fiber, and they definitely provide some prebiotic properties for your gut, and minimally processed foods. So the goal is to have more whole foods in our diet. And this is just easy for our body to digest. They're recognizable, they're easy to chew. Um, mm, and then highly processed foods with lots of saturated fat, trans fat, and crazy chemicals that we cannot pronounce from the nutrition facts label. Our body digests it, but common sense, if you think about it over time, your body knows how to digest the properties of a banana, the properties of a wheat, but the properties of a zebra cake, it's kind of like, what is this? Like, we're going to digest it, but over time, it's going to like all these chemicals are in our body. So definitely those foods, nuts, seeds, yogurt, fruits, vegetables, legumes, beans, lean protein, minimally processed, minimally fried foods, those are all going to be great in supporting good, healthy teeth, good, healthy gut.
This is a side note. I know there's been a craze between using different things like butter and ghee and even seed oils. Do you have like a hot take on that?
Yeah. So the less ingredients, the better. There is vegan butter out there, which people might be vegan for religious reasons. They could be vegan for just like animal cruelty reasons. But if you look at vegan butter versus regular butter, there's a lot more oils and chemicals in the vegan butter versus regular butter. So I say use the wholest ingredient out there. So butter versus the seed oils. Your body knows how to process that. But with that being said, I think in our culture, we need to realize portion sizes. You say, like, I hear a dietitian, yeah, you can have butter. It's like, yes, like this is what I've wanted to hear. We're going to use half a stick of butter for sauteing our vegetables. So definitely stick to like the realist ingredients and, seed oils. There's a lot more evidence coming out to support negative effects of seed oils.
What are the main categories of food, and well, how much are we supposed to eat of what each day?
That's a great question. So I separate them into 5 categories. These are the most important to me professionally. I feel like when I'm meeting with patients, these are the 5 that we talk about: carbohydrates, protein, fat, fiber, and water. So we need all of these. A lot of fad diets out there will rob Peter to pay Paul. So they'll not have carbohydrates, but we're going to have a ton of meat, ton of protein, and vice versa. Like, we're going to eat nothing but carbohydrates, but no meat, no protein. So having a good balance of everything. The recommendation for each item is really dependent on the person. If you're looking at a person as a whole, their past medical history is going to have some effect on recommendations. For instance, someone who is going through dialysis might have a higher protein need versus someone who is in chronic kidney disease stage 3. You want to have like a lower protein for someone who's in chronic kidney disease stage 3 versus someone who's going through dialysis. And that's where meeting with a registered dietitian is important, because a nutritionist might not understand that, because there's a disease. Kidney disease is so complex, and a lot of people are in the high protein craze. But if your kidneys are not filtering correctly, too much protein is definitely doing them a disservice. So protein needs are dependent on so many different factors. Carbohydrates also dependent on lots of different factors, depending on if you have diabetes, depending on if you're an athlete, depending, if you're a child, if you're growing. So, but a good rule of thumb is to take everything into one plate. I don't know if you remember the food pyramid back in the day. That is long gone, and it needs to never come back, because it was like bread at the bottom, sweets at the top. Like, I remember looking at it and I just was disinterested as a child. I was like, this is silly. This doesn't make sense to me. But now the USDA has come out with the My Plate. So it's just a picture of a plate. And I separate into 3 components when I'm talking to people: 1/2 and 2 1/4 components. The 1/2 is going to be where that fiber comes in. That's going to be your non-starchy vegetables like broccoli, cauliflower, carrots, zucchini, squash, all of those good food items, salad, tomatoes. You want to fill up half of your plate. You want to prioritize the fiber and non-starchy vegetables. And this is going to help with your gut health. The fiber is considered prebiotic. It's all of the ingredients that make up a good gut bacteria. Prebiotics are like, say we have a cake. Prebiotics are the flour, eggs, milk, sugar that eventually is going to get baked into a cake. Whenever it hits our gut, it's going to get baked into that good bacteria. Half of our plate, non-starchy vegetables. That's the general recommendation for a healthy person. And then the 1/4 section is going to be carbohydrates. Often we live in a culture where we like to overdo something so that we can take out something, but we need carbohydrates. We need rice, we need potatoes, we need corn, we need pasta, we need bread to function. That is the main source of energy for our body, for our body systems. We cannot move without glucose. We cannot move without the natural form of sugar. So what we have done is we've always increased the carbohydrates. I think we consume too much as a culture, but general recommendation for carbohydrate for female is about 45 grams of carbohydrate per meal. And then for men, slightly higher, about 60 grams per meal. But that also depends on activity level, whether we have diabetes, whether we have other things going on. So that's just general recommendation. And then another portion is protein. So that's going to be that other fourth. So 1/2 the non-starchy vegetables, 1/4 carbohydrates, and the other fourth is going to be your protein. And then we want this just as lean as possible. Chicken breast, ground turkey, lean ground meat, and we want to keep this about like 35 grams of carbohydrates per meal. 35 grams of protein per meal. And I think we live in a world also where we overdo the protein. So you'll see these TikTokers like what I eat in a day, like this cottage cheese pasta chicken recipe is 70 grams of protein. And it's like, that's great, but your body only metabolizes about 35 grams within a mealtime. And and the rest of the protein is just putting extra work on your kidneys. And then the last portion is water. So hydration is very important to help with your oral microbiome, make sure that you have some saliva and just overall body processes. So your body needs water to digest, it needs water to move, your muscles need water for repair. So the recommendation for water is based on your body weight. So it's based on your basic metabolic rate that you could calculate online. You could just type in BMR based on your height, weight, activity level. Basic metabolic rate is what your body is burning, what your body's metabolizing at rest. So like that's like what you would be doing if you laid in bed all day. It's just to exist. So that's the recommendation for water to survive. So it's going to be 1 milliliter per kcal, so per calorie of your basic metabolic rate. That's just to survive, but we want to thrive. So if we're working out, if we're, moving at work, you're going to want some additional water on top of that.
Are there any additional or alternative ways to stay hydrated besides drinking water? And how does your water intake affect your microbiome or saliva?
That's also a great question. Choosing foods that are water rich, so fruits and vegetables contain lots of water, unless you're going through something like dialysis where you were really focused on calculating your fluids. But I wouldn't calculate like, hey, I ate some cantaloupe, that's about 3 ounces of water. But it is also important to consume things that are going to hydrate us, especially if it's summertime. And yes, this is going to help your microbiome because it's going to help with your saliva production. It's going to just help balance everything out as far as digestion goes from here to here. Like it's just all intertwined.
What about if people want to drink like Gatorade? I know that's a terrible example because that's a lot of sugar, but other like hydrating electrolyte drinks.
Yes. So it is important to replenish our electrolytes, especially if we're working out in the yard. Sometimes water just is not enough for our body. And choosing drinks that have electrolytes in them, being mindful of what's in the electrolytes. If you have any issues like with your kidneys or you have diabetes, definitely meeting with your doctor to like confirm some of the electrolyte drinks that you're drinking. Gatorade is something that has a lot of sodium in it. So it's really for if you're sweating a lot. It has a lot of sugar in it, which is okay. It's not bad, but you think about boys playing a flag football game at 10 o'clock on a Saturday. They're definitely going to need some Gatorade because they're going to need sugar to replenish the energy they just used, salt because they've been sweating it out, and then all of the other electrolytes. Now, if we're doing some light yard work, glistening a little bit, maybe a Gatorade is not going to be appropriate. They do make the Body Armor Lights. I think that those are pretty good ingredient wise. There's no artificial sweeteners except for stevia, which is a natural plant-based sweetener. So it's actually natural out there versus aspartame or something like that. But like always, confirm that with your doctor. If you have any chronic diseases, diabetes, kidney disease, heart disease, we don't want to overdo any of the electrolytes, especially if you have heart disease too. Your heart needs electrolytes to pump. So always, if you're adding something new, consult with your doctor. And we want to make sure that they're lower calorie, lower sugar, depending on the activity level. If you're running a marathon, you're going to need the sugar and the salt for sure.
Are there any surprise foods that most people think are healthy but can actually be rough on the oral microbiome?
I'll say this, too much of anything is a bad thing. So we can have too much red meat or too much dairy. So too much dairy could be harmful to the gut microbiome. Same thing like with gluten, could be an inflammatory food for some people. If we overconsume it, it could definitely have some negative effects on the gut and oral microbiome. So too much of anything is a bad thing. Having a good balance, good variety in your diet. Even eating too much pineapple is going to be bad for the gut microbiome. But having a good variety, making sure that we're portioning out things and not overdoing anything.
How do fermented foods like yogurt or sauerkraut play into the oral and gut health?
They play a very important role. So there are lots of words that float around when it talks to gut health. I think gut health is very trendy right now, which is wonderful. Prebiotics versus probiotics. And I kind of explained prebiotics, but I'll explain it again. So it's the ingredients that make up something. So we're going to use it as a cake. Prebiotics are the sugar, the flour, the eggs, the butter that need a certain temperature, chemical reaction to produce a cake. We ingest the prebiotics, which are fruits and vegetables high in fiber, legumes, beans that are going to help form a good microbiome. So that's prebiotics. So those are just the ingredients that make up for a good, healthy gut. We need these things. Probiotics are like the ones that you mentioned, yogurt, sauerkraut. These are foods that already contain active bacteria, active cultures. Also very important to include in your diet because you're ingesting them, so they're going to get to your gut. You're ingesting them, so it's going to do some good here in the oral microbiome. And what these do is they create a good variety in our gut. They create a good variety in our oral microbiome to help fight off some bad bacteria because we have good and bad bacteria floating around and our body's just trying to balance it out. It's constantly at battle with the good and bad bacteria.
I'm learning a lot. What about snacks? Are there better choices for in between meals that are both gut and tooth friendly?
Yes. So, like I stated before, depending on your dentition, the quality of your oral health, hummus and vegetables are wonderful. Hummus is a great addition to anything. Like you could put it in a salad, you could put it on a sandwich, but you can also eat it for a snack. So with some veggies or a portioned amount of tortilla chips, hummus is wonderful. Same thing with yogurt. So yogurt, a parfait, making sure that your yogurt, when you're looking at the nutrition facts label and the ingredients, you see the italicized scientific name for the bacteria. If you flip it over and the yogurt doesn't have any active cultures, it's not really doing what you want it to do. So you want to make sure that you see the scientific italicized name of a word that you probably won't be able to pronounce. You know, you got the right one. Yogurt, also smoothies. Smoothies are a great snack, great way to increase your fiber intake, increase the variety of foods. You can add spinach to a smoothie, blueberries, yogurt, chia seeds, flax seeds, and you drink it. Also helps increase like meet your protein needs if you're having issues meeting your protein needs, but also helps meet your fruit and vegetable intake. Same thing with nuts and dried fruit. So depending on how how well your teeth can chew the nuts and dried fruit, 'cause dried fruit can also get sticky on your teeth. Those are also a great way for a snack, a good healthy snack.
We hear a lot about sugar and cavities, but are there other hidden ingredients that can disrupt our oral bacteria?
Yes, alcohol definitely is one of them, whether it's recreational drinking, just being mindful like, hey, this is, gonna get rid of some good bacteria. Increased intake of tobacco products, cigarettes, and then antibiotics. So that's something that is good, right? I'll tell a personal story. So as far as oral health goes, I had put off getting my wisdom teeth taken out all of mine were impacted. Did not have enough room for any of my teeth. Well, my wisdom teeth were impacted and one of them was growing out and then it got infected. I woke up one morning, my entire face was swollen. I was working in a different state, was not seeing my regular dentist, so I just needed a quick fix and they gave me antibiotics. Well, it got rid of the problem for the moment, but me knowing what I knew about nutrition, okay, I'm going to be on antibiotics, so it's getting rid of my good and bad bacteria. Knowing, hey, like I just need to continue to be like muscle memory, consistency, eating the prebiotics. That way, like if something like that happens, you're going to go through the course of your life and get prescribed antibiotics. You're going to have an infection. But if you have like consistency in eating the prebiotics, the probiotics, your gut health is going to be able to catch up after those antibiotics end. Yes, a lot about sugar and cavity. If we're disrupting that oral microbiome, we can definitely have more tooth decay from infection and bacteria.
That is something I've actually never thought of. Balancing your diet can help when you have antibiotics. So that is a great nugget for everyone listening.
Yeah, well, and in the hospital, we used to prescribe a Culturelle, like it was just a probiotic, oral probiotic, but we stopped doing that because it's like it was kind of defeating the purpose. Like you're on antibiotics, and so it's like it's taking the Culturelle and it's just like sweeping it away. But if you wake up every day and you have good lifestyle habits, you have a good overall healthy diet, your gut's gonna be able to bounce back and it's gonna know how to build that good bacteria.
What are 2 to 3 things that we can be starting to do today to improve our oral and gut health with nutrition?
So we have easy things that we can do. We can increase our water intake. That is definitely something very simple. We can increase a little bit at a time some non starchy vegetables, fruits and vegetables. Like add another serving of fruit, add another serving of vegetables, and then increasing your heart rate. So, blood flow has a lot to do with overall health. Something that you need to do daily is just increase your heart rate, whether that's a brisk walk, whether that is doing some strength activity. So, the recommendation for exercise is 150 minutes per week. If you break that down into 5 days, that's about 30 minutes per day. If you break that down even further, that could be 3 10-minute walks per day. Getting your heart rate up is definitely one way to help with blood flow, and it will definitely transpire into a good oral microbiome, increasing non-starchy fruits and vegetables, and increasing your water intake. It's something you can do literally right now. You can get up, do some jump jacks, go for a walk, drink some water after, and then eat an apple.
Let's say someone is dealing with gingivitis or early gum disease. Can food really help reverse some of the inflammation?
Yes, but it depends on the person. It depends on what's going on. So I've mentioned this before. Obesity is like a low rate of inflammation. So if someone is suffering with that, it might be a little bit harder for the gums to heal, but with management of possible medication from a physician and management of diet, you can definitely see those symptoms start to resolve. Same thing with diabetes. So maybe it's better management of medication and food choices that can definitely eliminate some inflammation.
Do you recommend things like intermittent fasting, probiotics, collagen? And if so, do they really help your mouth or is that more of a gut focus thing?
This can be like a whole hour conversation, but I'll just say this. There are red and green flags for everything. Intermittent fasting depends on the person. So if we're more susceptible to disordered eating patterns or diabetes, it's probably not the best thing to do. One, because it can promote some restriction. So depending on, and it's kind of a loose definition, right? I think everyone's definition of intermittent fasting is different. So their eating window might be different than their fasting window. I think green flags from intermittent fasting is you can really tone in on those hunger cues. So you kind of understand like, hey, how it feels to be hungry. Often we just eat on a schedule and we're not really mindful of what we're doing, but intermittent fasting definitely promotes hunger cues and it does decrease your caloric intake in a day. Now, what we're doing with that in between, I mean, I've met with people where they're like, yeah, I fast from 5 in the evening until 12 the next day and I eat a whole pizza and then I'm done. And it's like, well, we're also missing out on variety of foods. We're restricting lots of food groups. If done correctly, done with a healthcare professional, I think it's okay. I wouldn't just like go in on your own and fast because it's not sustainable. I mean, some people might claim that they've done it for 20 years, but it's really not sustainable. If you're on vacation and you want to go and grab breakfast at 7 a.m. at Waffle House with your family. Oh, that's in your fasting window, so you're gonna break your fast. So definitely there are green and red flags for everything. And you just have to watch marketers. They definitely follow the trends. I don't see any problem with collagen. I think that there are some beneficial properties to it, but always consult with your doctor because they know the ins and outs of what's going on in your body. Like if you have any chronic diseases or past medical histories where you're more susceptible to something, before you start any supplement, I would definitely consult with your doctor. Dietitians, it's not in our scope of practice to recommend supplements. We can tell you how much of a vitamin that you can have per day and suggest maybe certain brands, but at the end of the day, it is recommended from your physician. Is it more gut focused? I guess it depends on how you're doing it. If intermittent fasting, you have a smaller window that you're eating, you might be restricting. So it could be negatively affecting your gut health versus positively affecting it.
What is one common nutrition myth people believe when it comes to their teeth or gums?
I think the biggest one would probably be like no sugar. I think everyone's like absolutely no sugar. And that sugar is also a loose definition that people use to um, added sugar, sugary sweetened beverages, candy. Yes, that's probably not the best for your teeth, but sugar in the form of carbohydrates, fruit, apples, potatoes, those are okay. So I think that's definitely a common misconception, just like trend wise in our culture today. But always being mindful of like, okay, we condition our bodies to work out, but we also need to condition our mouths for hygiene. Like, so flossing and brushing is definitely something that we need in twice, sometimes three times daily routine. We can't just expect to eat healthy and not condition our mouth and think that everything's just going to work itself out.
Are there any trendy diets like keto, carnivore, vegan that might raise red flags for long term dental health or overall health?
Yes. So, keto, carnivore diet, those are kind of like the hot topics right now. Vegan has been pretty trendy for a long time, but keto diet, carnivore diet, they definitely miss one food group, and that's fiber. So depending on the interpretation of the diet, I think that's definitely up for everyone's interpretation when they say they're on the carnivore diet. It's like, well, define that for me because I think everyone does it differently. But generally, the keto diet, carnivore diet are eliminating most carbohydrates, most fruits, most vegetables, which contain fiber, which help with gut health. So, definitely, I think that we're going to start to see more negative effects from these diets as they come out. Definitely keto, we're starting to see more heart disease, heart related problems. But as far as gut health go, I can almost guarantee keto carnivore, you're definitely going to see some gut issues. Now, vegan is also one of the is a very loose term. If done correctly, vegan diet can be very healthy. You get enough protein, get enough fiber, definitely getting a lot of probiotics. But vegan is like absolutely no animal products. There's a vegetarian that can have eggs and fish. So it depends on the interpretation of the diet. But if done correctly, vegan can be pretty healthy and can definitely help long term dental and overall health. But I'll be honest, keto and carnivore diet it's trendy, and a lot of people can argue and debate until the cows come home. But you're taking away a major food group that helps with gut health. So
What would you recommend for parents that want to make changes but are busy and just aren't sure where to start with getting healthier food options for their family?
you can always start small. I always tell people it takes about 10 times for a kid to be introduced to something before they touch it, before they look at it, before they try it. But if they're looking at it, if they're touching it, if they put it in their mouth, that is a step in the right direction. So you can always like sneak a little bit of food on their plate. Say you make some roasted broccoli for yourself, just put it on their plate. Don't say anything. If they look at it, if they don't eat it, don't make a big deal about it. But introducing these foods at a young age is the best. But it's not too late if your kids are older either. Getting them involved in the cooking process, that's all the way down to going to the grocery store, then picking out some vegetable fruit. If they're old enough, they can start cutting up some vegetables, or if they're not old enough to cut, they can throw it in a pot. So they'll most likely try it if they are involved in it. If you have a garden, having them grow, I mean, it doesn't take much to make a garden. We have like a small box garden And it's funny because my 1-year-old, we have banana peppers. He will take the banana pepper off of the plant and just eat it like an apple. And it's insane, but he helps with it, like picking them. And although he does not cut any fruits or vegetables or throw anything into a pot, he's still involved in the process. If you want to get your kids to start eating healthier foods, include them in the grocery shopping, include them in the cooking process, sneak some food on their plate, don't make a big deal, and don't promote being like, you need to eat this or you can't have this. Like, you want them to start having a healthy relationship with food too.
If someone wanted to work with a dietitian to support their dental health or overall health, what kind of services or support could they expect?
You would just have to either get with your physician, they can send a referral to a dietitian. But we are at the day and age now where you can find a dietitian on your own. So I actually work with a company that my patients sign up on their own. Sometimes they're referred to by a physician. They can take a quiz, their insurance covers it, and they can meet with me for any general health reason. So there's lots of companies out there that have online dietitians, and a lot of hospitals do have dietitians on staff that you can see. But it's definitely a good idea to meet with a dietitian for just overall health, which can stem down to oral health.
Do you get their medical history or how does that work?
If I'm in contact with a physician, I can get their medical history, but when I meet with them, I obtain their past medical history, what they verbalize. So it might not be what's in their chart, but it's definitely what they verbalize to me. And yeah, get a detailed medical history, family history, all the things.
Where can people find you, follow your work, or book a consultation?
That's also a great question. I work for a company called Nourish, and you can search my name on Nourish, Jacey Fitzpatrick. I also have a link that I have on my Instagram. So if you wanted to follow me on Instagram, it's like a personal/professional Instagram. It's not private. So I'm trying to actually build it up a little bit, trying to do a little bit more, trying to have fun with it. It is JBFitz, FITZ _ nutrition. That's my Instagram. And then I have the link to sign up with a consultation with me, or you can just go to the Nourish website.
How long do you usually work with a client?
So it also depends. Usually on average, it's 8 to 10 sessions. So that could either be weekly, biweekly, monthly. Each session is about 45 minutes to an hour. So that's what my company recommends, that they see the best outcomes. And what's great about a telehealth company is people are more likely to come to their appointment. So instead of having to drive through traffic, come in between work, we really can meet where you're at. You can meet in your bedroom, you can meet in your break room at work. So we definitely see better patient outcomes just by being virtual. And we don't have to do a physical exam. You know, that's just something we miss out on, but usually physical exams are done inpatient anyway.
Is working with a dietitian usually something that is a provided insurance benefit, or is that usually out of pocket?
Yeah, so insurance, we are covered by insurance. Finally, it's taken a long time to be covered for wellness visits. But particularly on our website, you could take a quiz to see if your insurance covers. 94% of patients pay $0 out of pocket to meet with a dietitian. So that's wonderful. So even if you get one session a year, it's better than none. And more oftentimes, I don't know this statistic of my patients who they don't cover the next session, but it's a very small amount that I'll receive a notification, hey, they'll have to pay out of pocket and you won't be able to meet with them. It's a very small percentage. So usually most insurances will cover multiple visits with a dietitian, which is a huge step for our profession.
That's awesome. Do you have any last words of wisdom for anyone wanting to support their smile from the inside out?
I guess something I tell all of my clients, and I feel like it can definitely relate to anything in life, is, lifestyle modifications are something that you don't necessarily reach. It's not a goal that you achieve and you can quit. It's something you wake up and you choose to do every day. It's these habits that you put in place. It's like brushing and flossing your teeth. You have to choose to do them every single day. And the more you do them consistently, the more it's muscle memory and you just have better outcomes from it. So it's something you choose to do every single day.
That was an eye-opening conversation. I think a lot of people walk into the dentist's office expecting to talk about brushing and flossing, but not how their lunch might be affecting their gums or how their gut bacteria could be impacting their breath. Jacey, thank you so much for connecting the dots between what we put in our mouths affects literally everything. You've given us practical, science-backed tips that people can actually start using today. And I know our patients, parents, and followers are going to see their smile differently because of it. To anyone listening or watching, remember, oral health isn't just about what's happening in your mouth, it's a mirror of what's happening in your whole body. Take care of your gut, nourish your microbiome, and your smile will thank you. Until next time, keep brushing, keep learning, keep eating healthy, and stay gentle with yourself and your smile. Thanks for watching.